Is that better for you?
It's perfect. Yeah, it sounds really good. So thank you again for your time. I will be
Sure.
make the best of it. So I think if you, I'll do a short intro, and then if you could introduce yourself, if anybody doesn't already know, and then we can just kind of jump into a few questions. Does that sound okay?
I'm delighted, sure.
So I am a primary care physician and I work in Oakland. And this project is all about kind of telling the stories of physicians who have kind of had a climate awakening, and what that's really felt like in their personal lives, and then how it interplays with our professional role, and kind of the work ahead of us, which is very in keeping with your fantastic article about the moral determinants of health. So with that, if you want to introduce yourself, and then we'll jump into some questions.
Sure. Thanks so much, Ashley. So I'm Don Berwick. I'm a pediatrician by training. I began a nonprofit organization about over 30 years ago, the Institute for Healthcare Improvement, which I co-founded with some friends. And I ran that for about 19 years. And then I went to Washington at the request of President Obama to become the administrator of CMS, the Centers for Medicare and Medicaid Services, in 2010 and 11. And I came back to my home town in Newton, near Boston, Massachusetts. I ran for governor in Massachusetts for the Democratic nomination for a year campaign. And when I didn't win that, I went back to IHI. So now today I'm a senior fellow and president emeritus at IHI, the Institute for Healthcare Improvement. And I also am on the faculty at the Harvard Medical School. And I have a bunch of other boards and associations and nonprofits that I work with. And it's a pleasure to be with you.
So in your article, kind of the first order campaign pieces that would fill out what.
Ashley, your sound cut out for some reason.
So in your article,
Still can hardly hear you.
Really? How about now? Is that better?
Just barely. Use something connected and disconnected at your end.
Okay.
Yeah, now I can hear you.
You can hear me. Okay.
Yeah, now.
So in your article about the moral determinants of health and what the campaign pieces of that would look like, you listed kind of leadership on the Paris Climate Agreement as being one of the top order priorities. Can you share in your life, was there a moment where you identified the climate crisis as a crisis, and kind of when it first hit you in a personal way?
Sure. Not just a crisis, but a health crisis. I have to credit my wife. My wife, Anne, was for many years in state government in Massachusetts. She was Undersecretary for Energy. She was the head of the Environmental Protection Division of the Attorney General's office, and then she was chair, and after that, she was chair of the Public Utilities Commission. So she's an expert on environment. Today, she's the sustainability director for the city we live in, Newton, Massachusetts. So it's her career, and she's been my educator. I think that through the years, Anne has brought me so much information, the scholarship behind what we know about climate change, that it is man-made and that it has to do with our greenhouse gas emissions and other threats to the climate and the consequences now. Over time, of course, they become much clearer to me, even without Anne's coaching, as we watch the effects of climate change in, say, the Asian subcontinent, water shortages, displaced people, climate storms and climate-induced wars, and now, of course, as you and I are speaking, the tragic fires out in the western part of the country, not to mention Brazil and other parts of the world. So it's now become evident. But it was really my wife's coaching that did it. And then having nothing like having grandchildren. I have 7 grandchildren between about 2 years and 11. And I look at them and I just can't help wondering what we're handing over to the world. the world we're handing over to them. The other thing was a very pivotal moment for me, which is meeting Amory Lovins, the founder of the Rocky Mountain Institute, the famous climate scientist, not
Yeah.
just about climate. He's about sustainability overall. I read Amory's book Natural Capital, which I recommend to anyone,
Mm-hmm.
and his famous Foreign Affairs article on carbon and the climate, and that was the intellectual turning point for me, discovering that work.
Mm-hmm. Mm-hmm. And was there, so kind of that was over the course of a lot of time. When did you first feel that you had to get involved?
Easily a decade ago, trying to be a good citizen, but began working with Healthcare Without Harm,
Mm-hmm.
the immensely successful and great organization that's working not just on climate but other environmental impacts of healthcare around the world. I keynoted their annual meeting more than once and got to know Gary Cohn, their founder, and that
Mm-hmm.
was a big part of my coming to terms with what we had to do. And
Mm-hmm.
then Jeff Thompson, who was at the time the CEO of Gunderson Health System
Mm-hmm.
in Wisconsin. Jeff was probably the first CEO I knew who took this extremely seriously. And Jeff was, I think, just heroic in showing that in
Mm-hmm.
that health system, they could move very close to carbon neutrality and actually save money. And he had both the finance and the environmental responsibility lined up. That was very convincing to me. Even that one
Yeah.
case was enough to really open my eyes.
Yeah,
More
exactly.
recently, I've become involved in National Academy of Medicine work because our
Mm-hmm.
national academies of sciences, engineering, and medicine are over the past couple of years, and now even more this year, becoming, I think, very engaged with
Mm-hmm.
climate and health, decarbonization. We're going to see a lot more of that, and that's important to me because it's a way for me to work effectively on it.
Mm-hmm. Beautiful. So being kind of one of the most famous American physicians right now, what would you say to physicians who are sort of unsure about whether this is in our wheelhouse to speak about?
It's a very important question. It's what I tried to address in my article in JAMA that you mentioned, the moral determinants of health, and it's been
Mhm.
an evolution of my own thinking, which is, I'm a doctor, I'm a pediatrician. What I loved in the days I was in practice was to go into the consulting room with a child and parent and
Mhm.
lock the door and then treat one person.
Yeah.
But you can't be in the field, even as a clinician, without beginning to see the connections between the health status that we're trying to seek with our patients
Mhm.
and the social determinants of health, the
Mhm.
conditions around them that affect their well-being. And I've always been aware about conditions related to poverty and hunger and homelessness and environmental threats, lack of recreation, and now, of course, structural racism. Those all matter. And so,
Mhm.
as a healer, I've begun speaking out quite a lot in the past few years, saying if we can't just take a pass. I don't think, especially when we're 18% of the gross domestic product, 18% of our economy, and
Mhm.
very honored professions in healthcare. I don't think we stand by when we know the true causes of suffering lie in these social conditions. We need to
Yeah.
work to get them corrected.
Yeah.
And that led me to that article because it's bigger than that. Because if we
Mhm.
really think about health, community well-being overall, there's a moral content for me. I don't
Mhm.
know where it comes from, but it just feels to me right to say that we're together. Solidarity matters, community spirit matters, and caring for each other matter. And then you have to ask, well, in what realms do we have to improve that? And I
Mhm.
list them in that article. It has to do with healthcare as a human right, of course,
Yeah.
but beyond that, our criminal justice system, our immigration system, our infrastructures in our roads and transport and food security and education, but also climate, because
Mhm.
we're not going to be a successful planet, let alone nation, let alone community, on the trajectory
Right.
we're on now. So it just leads me there. It's uncomfortable, and my many colleagues in medicine do my talking. I know it feels uncomfortable. You didn't sign
Mhm.
on to this job.
Yeah.
But as I've said a few times recently, the job got bigger. If we're really going to be healers, we have to get
Yeah.
engaged. For
Yeah.
every individual, finding your portal of engagement matters. You
Mhm.
found it yourself,
Mhm.
Ashley.
Mhm.
It's certainly speaking up, writing about the topic as you want to do. I think engaging in local communities. In my
Mhm.
own town, there's plenty of public spirited work, nonprofits and others. You can get engaged in on any issue, any social issue. If it's criminal justice, you can get engaged. So
Yeah.
using that, becoming a citizen.
Yeah.
And of course, nowadays it's voting. I mean, we've just got to make American democracy work, because only that's the, to me, that's the foundation for solidarity, working together through government as a major resource to us. Government, as several heroes of mine have said, government is simply the name of one of the ways we decide to work together, and that decision matters. So it's politicized me in this realm, and I think
Yeah.
we professionals, I don't think there's a free pass here. I just can't think of a way that we can say, well, we don't do that and actually be working in the interests of our patients.
Yeah, absolutely. Yeah. I was really taken with your idea of healthcare institutions committing perhaps half of their lobby and government relations
Yeah.
budgets to social determinants of health. And I wonder if that as a pledge, would be something you'd be curious to explore with me further. Because I think, the way that Healthcare Without Harm has had such an impact, part of the way is kind of building up and making it socially prestigious to be sustainable in your own operations. But as you and I both know, we are only going to solve climate through governmental policies. And in my experience so far, like you identified, much of the government relations and lobby priorities of healthcare institutions are very self-focused. And I think there's a real opportunity to lift up institutions that are willing to commit in terms of the policy. Is anybody working on that?
I don't know. I'll say I regard government as necessary but not sufficient. I think there is public-private partnership here, and what Jeff Thompson did at Gunderson, that wasn't government. That was one healthcare organization with a visionary leader saying we can change this, and they did. So I think there is action that can be taken at the entity level, and I certainly encourage that. Kaiser Permanente just has had a tremendous success in carbon reduction, and I've been blown away by what that organization is now seems to be doing, and we have other successes to account for. But we do need government, and that means it just means engagement, and I don't know another way around. Now, my rather crazy idea, I doubt it would ever happen, but healthcare is one of the biggest lobbyist industries. I don't maybe the biggest in terms of dollars. And so I thought of this rather flaky challenge. What if we were to pick some of these social ills that are really killing people, the opioid epidemic, the problem of a criminal justice system that's really doesn't do justice at all, or climate, and say to the American Hospital Association, American Medical Association, the guilds, the representatives who understandably fight for higher reimbursement and for their own segment. But what if they took my challenge was that you're referring to is took half the money you're putting into lobbying for the next 3 years and pick a couple of these social determinants, these moral determinants. What if we said we're going to take half that money and lobby the heck out of all governments, state and federal, to change the way we deal with incarceration, or change the way we deal with climate? It would be a turning point. It would be like an act of leadership that would be astounding. Of course, I don't expect that is likely, but thank you for taking the idea seriously, at least, Ashley.
Well, I think it's so compelling. I mean, our profession has that legacy, of looking out for people's best interest in a way that's not swayed by finance, that's like altruistic. And we don't have time to not,
Yeah, I mean, altruism is alive and well. This is altruism in the political space. It's saying we're going to take our political energies and move our government agenda toward justice. That would be, to me, that would be healing. To me, that would be that would be healing, and we're supposed to be healers.
Yeah, absolutely. Do you have any heroes in medicine that you look to that kind of embody, the physician's role and opportunity to lead in climate and other social justice issues?
Many. I mean, it goes back to some of our historic figures. Virchow, for example,
Mm-hmm.
wrote eloquently about the need to be engaged at this level if we're going to be a healing profession. I'll nominate for my hero of in my lifetime, for me, is Dr. Howard Hyatt. Dr. Hyatt was he was a young and brilliant you know biologic scientist, physician, and young chair of medicine
Mm-hmm.
at Harvard, who decided to switch to public health as his career and became the dean of the Harvard School of Public Health, to everyone's surprise.
Mm-hmm.
But Dr. Hyatt, who I credit as being probably my main mentor and now close friend for many decades, he began speaking out long before it was conventional on the need for working on the policy side, the politics side, and the social side to create health and well-being. Because he
Mm-hmm.
came from biomedical science, he was especially credible, I must say. But
Yeah.
every time I get involved in discussions like this with you, Ashley, I go back to very fond memories of Dr. Hyatt,
Mm-hmm.
who paved the way for this kind of thinking in many ways.
Yeah. 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 Dr. Berwick, one of his quotes is my email signature, that all diseases have two causes, one pathological, the other political. Um, and I think
He was
that
right.
he was right.
Yeah.
Oh man.
Yeah. It's so
Um,
uncomfortable because, as I said, as physicians, we didn't sign up for this, did we? I mean, this wasn't
yeah.
what I thought I was headed for. But if the logic and the science and the epidemiology point there, we have to go there.
Yeah, yeah, bravely distinguishing between partisan lobbying and political advocacy, which I think
It
that
doesn't have to be
distinction.
partisan, but it does have to be political because we need resources, and it has resources from government, and that's going to be negotiated. And so we better
Right.
be clear about what's needed.
Mm-hmm. Yeah. Um, in your braving this edgy, uncomfortable progressive realm, and speaking out about the need for physician leadership for health on the social determinants and climate in particular, has that given you anything or like enriched your life in any way?
It was a wonderful question. Yes, there are so many people in our nation, in the world, who want to fight for justice, who really believe in the essential value of taking care of each other. And so, in this realm, through my conversations and connections in some of the organizations that I've working with, I meet people from other domains who are deeply committed. Education, for example. I mean, the educators I've come to know who just are struggling to figure out how to help our children thrive when we're underinvested in kids. They're wonderful to meet. People from our Native American community. I've for some reason developed very deep feelings about the injustice and the suffering in Native Americans and Alaska Natives. And man, I'll tell you, they're so moving to deal with leaders in that community who are not just concerned about health. They are concerned about health, but about well-being overall. So I think this whole conversation, and climate is one of the areas, is an area of intersection, disciplinary
Mm-hmm.
background intersection. That, to me, that's that's really enriching. The other
Mm-hmm.
thing is youth. you know, I do believe the younger generations, a lot younger than me, they get this, they get it, and there's a sense of energy and fuel for change in youth, and I just love the chances this gives me to deal with younger people, not just college, high school, even elementary school. It's been the future. If the future's in their hands, really, then we'll be okay.
Yeah, absolutely. That's a theme that I definitely keep hearing is the motivation for our children and also, like Greta Thunberg and
Yes.
others kind of being willing to speak out that business as usual is catastrophic. I think, yeah, a lot of people really resonate with that. So not everybody has your stature. And I'm curious, for others who really look up to you, who don't have the hierarchy to stand on, what would you say to them in terms of kind of advice for bringing these conversations up that are uncomfortable for physicians typically? What would you say to them in terms of kind of giving courage to make climate a medical profession priority and responsibility?
Well, I don't personally feel the stature you're so kindly mentioning. I mean, I think you're just like me, and we're all trying to figure out how to help here. And it's such a big problem. And I guess a couple thoughts. One is that is to reconnect to our citizenship, and this sequence I have: speak, write, work, and vote. I believe in that. You can speak up wherever you are. I'm talking about cocktail parties and Zoom meetings. Talk about this. It's got to become voiced. Write about it, as you are intending to, Ashley. Thank you. But physicians write op-eds and letters to the editor, and then the work piece. Find our colleagues. Pick your topic. I'd say make it climate change, or make it criminal justice, but pick it, and you'll find friends right away. There'll be people 2 doors down from your house who are working on it too, and you can join. You can be part of that. And I've recently been talking to Rotary clubs. For some reason, they started asking me to speak, and those are communities, and they want to listen. They want to know what to engage in, and you can do the work. And then vote, and get 5 other people who otherwise wouldn't vote. Restore confidence. You can do that as an individual.
Yeah.
I think the edgier concern is in the consulting room. So I've gotten some inquiries, emails from people who've read what the article you wrote, saying, well, is this really right? I mean, when I see my patient comes first. They're here for a problem. I need to help them with it. Why would I introduce politics into the consulting room? And I must admit to uncertainty about that. Here's my answer right now, which is it's not politics to introduce voting into the consulting room. I think we have a symptom in this country, which is people not voting, and the health consequences are enormous. And I'm not saying tell people how to vote, but how about when you're seeing patients, just reminding you how important it is, I think, to vote safely this time around. I would go that far. Also, you know what? Your patients are thinking about this. It's on their minds. And I think even at a level of mental health and behavioral health, being able to tune in to our society today, which is reeling from COVID, reeling from the George Floyd murder, reeling from real fear about climate change and what these disasters mean. I think that belongs in conversation, not forced on people. But let's meet our patients where they are, and if they're there, let's go there and have a conversation about health and the choices we make as citizens. That's the best answer I can give. Will everyone be comfortable with that? Of course not. But at least it's worth thinking about, and I'm thinking about it.
Yeah, definitely. The patients that I have talked to make sure, like, did you update your address for voting by mail? And, are you ready to vote? There's been such a sense of solidarity, transcend the physician-patient relationship to just our shared humanity, and I think when I ask them if they're ready to vote, it communicates to them a sense of like, your voice matters, and I care about you, and you're being represented. So it's been really powerful.
There'll be those, Ashley, who disagree with that, but I don't. I think that's just right. I think my guess is, for most patients in most circumstances, when you do this with dignity and respect, they don't just accept it; they like it, and it's it is a way to connect as a human. Yeah. So thank you for what you're doing.
Yeah, my pleasure. Any other parting thoughts you want to share?
No, it's a time for engagement, Ashley. That's what you're doing, and that's why I'm lucky to join you. And I hope you reach out to many.
Yeah. Thank you to your wife for her leadership.
Yeah, she's the one you should be talking to. Exactly.
Really
Thanks.
appreciate it, So
All
thank you
right.
so much. Really appreciate
Yep.
your work. Take care.
Be well, Ashley. Let me know how
Bye.
you do. Thank you. Bye-bye.